common in like 80% of the population or something like that, so. It's hard to diagnose what is going on. Okay, so the spondy can lead to a spondylolisthesis, and that is where that vertebral body will actually just slip forward and then in turn cause a disc problem too. So it can either get bulged out or just degenerate as well from all that pressure of the vertebrae. So yeah, there's the crack right there. And then from pretty much either not catching it on time and continuing to do activities, that's where you get the spondylolisthesis. Pelvic cross syndrome. This is where you see a lot in people who have like a weak or type psoas major, hip flexors too, and then they just kind of like the way that they have the belly breathing, and so that belly pushes out. You can see where that lumbar spine curves in more. You get more like the kyphosis going on as well, and that in turn causes more stress on the vertebral bodies and the disc as well. So things that you want to look for in patients with the low back pain, like look at their posture and whether or not that can lead to having these kinds of injuries. It's like where their bellies are being pushed out and they're breathing.
So is it the same thing as kyphosis and lordosis? Would it be the same thing, lordosis?
Yeah. Yeah, that's
lordosis. The pelvic cross syndrome? Or is it both of them combined?
No, yeah, it's both of them combined because it's going across the midline both ways. Yeah. So I'll show you. Okay, so how to fix it, and I'll show you guys some exercises that we do for pretty much anyone with low back pain. But what you want to do is teach them how to activate their core. I know we've talked a little bit in lower how if you have them do a straight leg raise test, and you can tell whether they're activating their core or not, or if they're just using like their hip flexor and their quads. So just by observing that, you can tell whether they're activating it or not and not activating it. That way, in turn, if they are trained to be able to have a strong core, when they get out onto the field and whatnot, they'll be able to brace that instead of using something else to compensate for it. Just for like an example, if you're teaching a deadlift and the proper way to do it is, get down, brace your core, and then come up with it. If they release that core at all, like right before the lift, their back's going to compensate for it. Rather than using their core, keeping it strong, and then using all your legs to do it. So, I'm sure Jasmine knows about that. Maxing out this week. Okay. So, a little bit else that can go into low back pain is tightness in the hamstrings, glutes, piriformis. Since those, cross the hip joint as well, that can pull a lot of pressure on the pelvis, and just having those lumbar muscles getting tighter and causing that low back pain. Having that posterior pull on the pelvis, like if you imagine it, like your pelvis will constantly get pulled. And then you can look at it the other way too, where if they have tight quads, they can have that anterior pull on it. So you can evaluate the hamstring tightness that way. I should show you. Yeah, let's do anyone up here that Alright, sorry. So,
I was looking at it into my room.
yeah. Yeah, I'll do that.
So,
Okay, so first thing, like I always do whenever I'm evaluating someone with low back pain, I'm automatically thinking like, okay, let's check their hips and whatnot, and then go into hamstrings and, okay, so bridge up real quick. Okay, there you go. You can go back down. Okay, so what I'll do is I'll look at their leg length, and then I'll check out their SI joint, and you'll see like that's pretty good. Like if they can get to 90, then that's fine. But, and I mean, she's not having low back pain or anything, right? No, so you can tell. That was a little more flexible, huh? Okay. So when you're looking at their, right here, when I'm looking at this, I'm looking at their medial malleolus and seeing if they line up or not. And by that, you can tell whether they'll have a leg length discrepancy, and then from then on, I can check their hips to see whether they go forward or whatnot. I wish there was someone with bad hips or something, so then I can show you how to fix it.
I always have
Seriously, Miranda, so do you.
Yeah, it is. What's wrong?
Oh, I always have low back.
Oh, you do? Well, I'll look here.
it's kind of weird.
Let's figure it out.
Come up here.
We have some brains in here. All of us together make one.
Dang.
So you always have low back pain?
Yes, yeah.
On both sides?
What?
And you've never gotten, okay.
Pain on your head ripped off or anything?
What was that, Marina?
Okay.
Never
bridge
had
over
any
quick.
history of
Like
Can
bring
you
it
hit
over.
ripped off?
getting your head
Okay,
ripped off.
back down.
Did you want to see that?
Yeah. I like keeping my voice. Like,
That hurts right there?
Yes.
All right, so.
I'm also sore.
Here's a good, did you work out?
Yes. There.
That's my point right there. Okay, so she has some pretty bad hamstring tightness too. I mean, there'd be some other things that I look at, like is your history, whatnot, like when did it start?
Oh, I have like a long time ago.
You just have always had it?
Yeah.
Have you tried anything different?
It started when I used to play tennis.
Okay.
I used to have low back pain, but I also thought it was because of the tennis. I don't know.
Mhm.
And then.
But it's not, is it painful all the time?
No, not all the time. Just
Okay.
like maybe twice a month.
Oh,
Like,
okay.
when it hurts. And I don't know.
Hmm.
I don't exercise anymore.
Oh, you don't?
No.
What
Since
do
I
you-
tore my ACL 2 years ago. I don't go running or anything.
This one?
Yeah. No, wait, no, this one.
Okay. All right, you can come up. Okay, so hamstring stretching would really help you.
I'm sorry.
Yeah.
They're tight.
Yeah.